Okay, so today we'll start with the next readings for somatometry. Yesterday we have covered till nasal measurements. Okay, so today firstly we'll cover the measurements for head, and then we'll start with the measurements on trunk and limbs. Okay, the first thing we'll start is with the auricular height. Yeah, so this is where we finished in the last part. Now, auricular height is understood as a projected distance between two major or very important points, which is trageon and vertex. Okay, now vertex, when you position a person, a subject, in a mid-sagittal plane, their head is oriented in a Frankfurt plane, the maximum point in the mid-sagittal plane over their head, generally this point is used to calculate also the maximum height, standing height or the sitting height. So this landmark basically is the most uppermost point of the head in the mid-sagittal plane. Okay, the second point is trageon. Now trageon is identified at the uppermost ridge of your zygomatic arc. Let me show you in the figure. Yeah, so there is a tragus of the ear, which is generally taken for the calculation for identification of trageon, and also with reference to the zygomatic arc at the uppermost ridge of the zygomatic arc on the most uppermost lateral border of zygomatic arc, which is almost adjacent to the trageon point at the tragus of your ear. That is identified as trageon. The definition to trageon is the point at the upper margin of zygomatic bone or a slight notch-like structure above the tragus of your ear. So this is the landmark definition for trageon. And how do we measure this is basically using the first segment of anthropometry or anthropometer rod, which is also called as rod compass. So that is used, as in we keep it on the floor surface, and then we do not keep it on the floor surface, one point is kept on the vertex and one point is brought to the trageon point at the tragus of your ear. So that is how you calculate. So only the first segment of the rod is used for that. Okay, so this is the auricular height. Next is the physiognomic facial length. Now, how do you identify this? As a straight distance between gnathion and trichion. Okay, so the 2 points, the one being gnathion here, the most lateral point of your chin is identified as gnathion. Here at the chin is the gnathion, whereas the other point is trichion. In this figure it's not labeled, but see where you have the starting of your hairline in the mid-sagittal plane. Okay, so that is identified as trichion. Wherever is the hairline starting, from there in the mid-sagittal plane, that point is identified as trichion. Okay, so this is how you take the reading for your physiognomic facial length, right? Then next coming on to is the morphological facial length. Also, one important thing here, you do not use the first segment or any other thing but the sliding calipers with the blunt ends. Blunt ends, why? Because we are using on the human surfaces, the human skin, so we do not want to hurt anybody, so we use the blunt ends, sliding caliper. Next is morphological facial length. Now see, the difference here is, here we are taking from trichion, which is from the hair, that is we are including the forehead portion, but in the morphological part we are only using the nasion and again measuring till gnathion. Gnathion is the point, the lateralmost point on the chin. Again varies for person to person. So how do you take the measurement is, you first use a skin marking pencil, you mark the centermost point or the most lateral point on the chin, and on the frontonasal suture, which is not visible in the face, like in a human face. For that you take the most point of depression on the nose, okay, in the nose root, a point either below that, above that, or at the point of nasal root, not the glabella. Okay, it's a point below the glabella. Sometimes it's above the nasal root, or in some cases it is the entire depression of the nasal root. Okay, so nasion has to be very carefully marked. Again, we do it by marking using a skin marking pencil, and using the sliding calipers with the blunt ends. So this is how do you differentiate between the physiognomic facial length and the morphological facial length. Okay, next is we'll take up the ear length first. Physiognomic ear length. Now this is a straight distance between supraoral, SA, and suboral. Now we're talking about the length. So supraoral basically is the highest point on the helix. Helix as in the outer ear, the outer lining of your ear, external ear, is the most highest point of that is called as helix, whereas suboral is the lowest point on the ear lobe. Let me show you. Yeah. So when we are taking the length, because we have to do it vertically, so the highest point on your helix, the external ear, this point, this external ear, the highest most point is supraoral, and the lowest point of your ear lobe, okay, the deepest depression which you can say of the suboral is identified as the suboral. So from here to here we take the length, which indicates the ear length. Now we again do it using the sliding calipers with the blunt ends. Now what is the physiognomic ear breadth? So breadth, again, horizontal distance we are taking. So it's a straight distance between two most lateral point of ear. One lies at the base of the ear and other at the most posterior border of the ear cartilage. So from here we take from the tragus. Now tragus is also visible in this. So here also you can see, in a sort of zygomatic arc is being projected. So this point is identified as tracheon. Tracheon is in the hairline. This is the tracheon. Okay, so from here, or depending on the most external point at this side to the most deepest point here at the notch, we take the measurement, which is identified as the physiognomic breadth of the ear. Fine. Most lateral point, one lies at the base of the ear and other at the posterior border of the ear cartilage. Fine. Then we'll be moving on to the indices. The remaining will cover gradually. Okay, so we'll take indices all together. Next we'll start with the measurements on trunk and limbs. Indices will do both of them together, for head and for trunk and limbs. Indices will cover all together. Right, now measurement on head, on the trunk and the limbs. So first important thing is the height vertex, or the standing height. So again, a very important marker, landmark, which is the vertex. So when you take a measurement of the vertical distance from the floor to the vertex, is called as height vertex, or the maximum standing height. Again, the entire anthropometer rod is used for that. So what exactly is the landmark of vertex? The most superior point, right? The topmost point in the mid-sagittal plane when your head is held in Frankfurt plane. Do not forget to mention the Frankfurt plane, because it is very important. Firstly, you orient the head. Firstly, you orient your the subject's head, and only then you take the measurement, right? Now here in this figure, you can see where exactly holds the vertex. Firstly, you have to see the ear plane is oriented or not. Only then you can take the maximum point, because sometimes, let's see, if it's tilted downwards, the vertex would lie somewhere here, right? So do not do that kind of mistake, and do not forget to write Frankfurt horizontal plane or the ear plane, when you're mentioning vertex or taking any measurement related to vertex, right? Yeah, so this is height vertex. We use the anthropometer rod. Next is height triggers. So height triggers basically is a measurement of vertical distance from trageon to the floor. And now we have already studied where trageon is, the uppermost border of the zygomatic arc or the notch of your ear, or because we have a tragus bone in the ear. So with reference to that, the name is given as trageon. Okay, from there, again orienting the person's face in ear plane. After that, you hold the anthropometer rod from the right side and then you take the readings from the left side. That is how you do it. Measurement of the vertical distance from trageon to the floor. We use the anthropometer rod. That's it. Next reading is height iliospinale. Now we'll cover this later. Height iliospinale basically is a vertical distance from the anterior iliospinale to the floor. Now, if you remember when we were doing forensics, I guess, and we were taking up the anatomy, the skeletal anatomy, there was a reference of iliac spine. Now, the most anterior point, what you do is when you take the measurement, you ask the person to stand, comfortably in an ear plane, their arms hanging straight, right, on the sides. In that case, you take the most interior-most point of the iliac spine. So it is below your abdomen towards your thighs, just below your thighs. So the most you will see the most posterior point on that spine. Again, it varies for person to person. Also, you have to ask them if there is an extra clothing, then you have to remove that extra clothing. I'm just telling you how you take this measurement. You need not to write all these in the procedure. You have to ask the person to not wear extra clothing. So removing the extra clothing first, standing in the right side of the subject, locating the most interior point on the iliac spine, and then from there you'll position your anthropometer rod, put it on the floor. Okay, first arrange it, put it on the floor, and bring the caliper at the most anterior point which you have marked. Here you cannot use a skin marking pencil because you cannot ask the subject to be entirely off the clothing, so you cannot use the skin marking pencil. It is only by the point that you can touch with the help of your fingers, right? So that is how you mark the iliospinale, the most anterior point on the iliac spine. So the vertical distance from the floor to the anterior iliospinale is called as height iliospinale. Then we have the height tibiale. It's also called as the knee height. Now tibiale, again, it is identified as a vertical distance between tibiale, the landmark, and the floor. Let me show you tibiale. Yeah, see here, below the patella or below your knee area, there is a projection in the medial side of your legs, lower leg. Okay, that portion, the most protruding portion, or say the prominence that you can feel in that area, is identified as tibiale. Okay, so from here you locate the the anthropometer rod on the sides, and you bring the calipers till here, and then you locate the tibiale, and then you take the reading. Okay, so tibiale so far clear. You use the anthropometer rod. Tibiale has an abbreviation TI. Next is height spherion. Again, all these names are in reference to the bones that we are studying. Okay, so here we are taking a vertical distance between the spherion and the floor. So here you can see the point spherion at the bottom of your lower bones of your legs. there's a point which is identified as spherion here, in the area of your ankle, but not here at the ankle. It's a sort of projection here in the foot, above the foot. So that projection is identified as spherion, and that you take from the floor to the spherion. So only this height is taken for height spherion. Got it?